When you hear about sickle cell disease, you probably think of Nyanza, Western, or the coastal region. But rural-urban migration, with people settling in areas like this, has seen the disease move beyond regional boundaries.
We do get patients from as far as Kisumu, Migori, Homa Bay, Mombasa. Historically, it's because of those are the areas where there's a lot of sickle cell, and those who get word that we are sorting sickle cell in Nairobi would still want to travel all the way to Nairobi and then get treated here. Many of them who used to come in crisis no longer come in crisis because they are empowered to know what to do whenever they feel that they are getting into crisis.
This journey has been no mean feat for people living with sickle cell disease. George Audi, the country director for the German Doctors Projects in Kenya, is a team leader at German Doctors Baraka Health Center, located in Mathare 4A, an informal settlement area in Nairobi. The sickle cell disease program is one of the areas that George and team have embarked on to change the lives of the residents in their catchment area.
We started our sickle cell program in August 2014. So last 2 months, it is now 7 years. The need came about because we have people who work or immigrated from the lake shores and they work in Nairobi. And we realized that we are seeing more and more children who have this condition called sickle cell. And together with other people who were already dealing with this disease, because Sickle Cell Foundation, we established that program to see not just children, but also youth and young adults who are struggling with the disease.
This has taken a lot of training for both the sickle cell warriors and their caregivers, including teachers, particularly those in boarding schools, so that they understand the disease better in order to offer proper support.
We have seen even people who are not sure whether they can get in relationships, getting relationships. Of course, they have been told how to take care of themselves with the relationships, because sickle cell is actually a hereditary disease. You pass it on to your offsprings. So we feel that the education and the patient follow-up has played a major role in the treatment and awareness about sickle cell.
Providing emotional support for the caregivers, who could be parents or the guardians, is a key pillar in making sure the people with sickle cell disease do not go into crisis. In limited resource settings, as is the case for many of the sickle cell warriors attended to at Baraka, fathers need to play a key role.
We also try to involve both parents, especially where they are both parents. Fathers play a key role on the management of this disease, especially for adolescent boys. When they reach their teenage time, they get this thing called priapism. So it means when they have an erection, it stays for too long because blood does not flow back. And that can be painful, and if they don't have anybody they can explain to, they may not explain it to the mother, then it becomes very tricky. But through involvement of parents, uncles, other caregivers, then it is much easier for the children to grow up well and in a comfortable situation. Their milestones are sometimes delayed, and if they have somebody to share this or they're empowered, then they grow well. We have a booklet which they can also read, both in English and Kiswahili.
People coming to this facility find reason to, regardless of which part of the country they hail from.
They find it easier because whenever they come here, they feel that they are being followed well, they are asked relevant questions, correct testing is done, especially the HB electrophoresis. And the medication is also always available for them, including the hydroxyurea. Even if they cannot afford it, then we have a system where they're given the medicine without paying.
Without the availability of this machine in the hospital, a machine for HB electrophoresis, many parents who needed to know what was ailing their children lived anxious for longer periods, uncertain of what to do. Baraka Health Center used to send samples to Eldoret for testing to determine whether one had sickle cell disease or not. Quick management of patients happens now because the integrity of the samples collected is maintained, and in case there is need to repeat a test, the sample and the machine are readily available.
We currently work hand in hand with Children's Sickle Cell Foundation, especially on patient education, which we feel is a key component of patient management. We also work with Novartis, as I already mentioned. They provided just not the electrophoresis machine, but also a biochemistry machine, because from time to time we must also do things like liver function tests for these patients so that correct medication is given.
People with sickle cell disease are in constant need of at least 4 different types of daily medicines to prevent them from getting sick and falling into any other sickle cell crisis. These medicines, like hydroxyurea, are costly, not less than 1,200 Kenya shillings or $120 in a month. Children under 5 years and the elderly above 65 are attended to free without the need to pay out of pocket once in this facility. Those who may not qualify for free treatment undergo social screening first.
The German doctors started a fund that has been helping many patients. We've helped so far over 5,000 patients with food. We have a food pack, which is very heavy. We give twice a week, and we give to about 80 patients every time we are giving. It's not only to the patients of Baraka. We opened this to the entire community because we have about 50 community health volunteers. They visit people in the homes, they do patient follow-up, and when they find a patient has no food, they come and report to us. So we write down their names, their contacts, and we give them food. Yes, and we also feed St. Luanga Kindergarten. It's just next to our nutrition center.
The 50 community health volunteers attached to this facility ensure that there is a good network of communication between the facility and the community.
Because I'm a trainer of community health volunteers, we trained these volunteers who started mobilizing mothers to come for education on what to cook for the children, how to take care of the children, importance of going for immunizations, for antenatal care, importance of hospital delivery, and so we started from there. So we referred, for the services we didn't have by then, we referred patients to Mathare North Health Center, to Zima Dispensary, and in 2004, we had a small VCT with one councillor. Then these councillors were trained by the German doctors. They were chosen among the staff who were coming in. Each day we would add one staff or call for an interview just to make sure that we met the needs of the facility, as small as it was by then. So among the community health volunteers, some who had done Form 4, completed secondary school, were taken for training by the German doctors to have a diploma in professional counseling and testing. And so we started our VCT 2004-2005.
Rose Omia was one of the first 3 members of staff that helped set up this facility in 1997. She has seen growth, the facility now attending to hundreds of patients in a day.
When we opened our doors, only 5 patients came on day 1. And then the number started growing to 10 to 20. And we had 2 German doctors who started with us.
When we look at our medical records, it informs us on the most prevalent diseases in our catchment area. So that is how, and that is what informs our strategic thinking going forward, because we draw 5-year strategic plans. So based on the needs, like currently we are looking at eye clinic, which is already here, dental, and the next one on the line is a dermatology clinic, which will start in 2 months' time. So it is informed by the output from the medical records department.
Baraka Health Center attends to sickle cell disease warriors every Tuesday and Friday. When we visited the center early on a Tuesday morning, the queues were long, everyone in need of medical attention.
We have tried to bring this disease to be known by many people, including the Ministry of Health. So we have sickle cell days in a year where we involve many stakeholders. Our focus in our program is that we don't just focus on the patient. Anybody who is in the ecosystem of the patient is involved. Teachers, parents, CHVs. Because these children need a lot of rehydration. So it means if they're in school, they are also likely to be going to the toilet many times. And if you don't involve the teacher may think the child is just being naughty. But once the teachers, the caregivers, the headmasters are empowered, then it makes the work much easier for everybody.
The main goal at this health center is to make everyone who visits here a custodian of their own health. And for people living with sickle cell disease, a good understanding of the disease, how their bodies respond to certain triggers, and support from their guardians is the first step to living a long and healthy life. Dr. Masi Korir for KTN News Health Watch.